With the discussions spearheading towards making a difference in various African health sectors, the government of Kenya pointed out that Kenya's health market is set to grow to $65 billion in 10 years, creating a huge market for the private sectors. However, Health Cabinet Secretary Cecily Kariuki urged private sectors to focus less on high returns from various small sectors and deliver healthcare as a first priority, which is largely a public good.
Importantly is for me to urge the private sector to look at delivering healthcare, which is largely a public good, by looking at the volumes as opposed to small volume business with high value returns.
Even as Kenya stood out as a country with great facilities, underutilization was a big concern, corruption coming up as a major challenge in both sectors. Spearheading one of the discussions, Professor Kamarogo questioned leaders from different countries on the lack of progress, despite the availability of funds, challenging them to speak out and accept that corruption has greatly affected the sector, insisting that silence is not an option, as he asked the leaders to point out resolutions that will provide a way forward.
We are quite comfortable saying that this is okay. Since I'm not corrupt, but the system is corrupt, let us continue the way it is. What I would have wanted to get from this conference is to really dig deep into this thing. Because the truth is, we are going nowhere. We're going nowhere the way that we are planning and budgeting, the way that we are organizing all these good documents on management and the structures, on committees and so on, and the private sector doing what it can, and it is business as usual.
Businessmen were also not left behind, as Manu Chandari insisted that the government should be more open to corporate responsibility since they cannot do it alone.
Because the government alone cannot do it. We know it, they know it, but none of us are prepared to accept it.
Quality healthcare was a huge concern in the discussions, and the leaders came to a conclusion that it's necessary for hospitals, no matter how small or big, private or public, cheap or expensive, to provide quality healthcare at its best.
Whether it's here in Nairobi or it's in my rural village, if something happens, somebody is held accountable. That's the day that we'll know our healthcare is headed somewhere.
It needs to be a process of driving a proactive approach to quality and safety that says, look, we want to drive this agenda. We are doing it from a proactive approach, not because something has gone wrong, but because we need to improve the quality and safety of our processes.
The discussions went around through different aspects like how technology has improved the sectors and how to improve business returns, urging health sectors to prioritize quality first through collection of data, creating accountability, transparency and zero tolerance to corruption, aspects that will definitely see the sector thrive.
Start small, start where you are, wherever you are. You have some data. Maybe it's not the best data, maybe it's not the most amazing data, but start. Because from anyone I've seen go from not measuring to measuring, it's quite simple. What gets measured gets done. If something's not being measured, it's not going to happen. And if you start measuring, even if it's not perfect, measure for a while, and you'll see that in a short period of time, there'll be improvement, simply because when you're being measured, people perform better.
Njoki, Merita, Switch TV.